are the short-term side effects associated with bispecific antibody therapy?
Yeah, so the short-term side effects that we're watching for are these reactions in the hospital called CRS, cytokine release syndrome, and neurotoxicity. So the CRS is a inflammatory response where cytokines are released and usually cause a fever. We monitor and make sure that the fever isn't being caused by some sort of infectious process or there's no other cause for the fever. And if not, then there are medications we can give to help reverse these side effects while you're in the hospital. So the way that we treat that is, again, we'll make sure that there's no sort of infection or other reason for a fever. And if the patient continues to have the fevers and they have low blood pressure and changes in their oxygen needs, which is kind of what happens if this inflammation progresses, is we'll give things like dexamethasone, a steroid, or another medication called tocilizumab to help kind of reverse the effects of the cytokine release.
Who else is on the healthcare team when someone receives these therapies?
Yep, so you'll always meet with your oncologist or, an oncologist at the academic medical center where you're going to be getting the medication to go over potential side effects, what the treatment entails, and consent. We have nurses here that are specific to bispecific antibodies that help coordinate with your local team if you're going back to your local practice. We have the infusion nursing team, who are the ones who are actually giving the bispecific antibody therapies and explain kind of what to watch for at the site where the injection goes. And then we have pharmacists who are also available to meet with you and go over any questions you may have about the treatment.
What do we know about long-term side effects? Are there any?
So long-term, what we're really seeing is risk for infections. So all of these medications lower your blood cell counts, and we have to watch for these opportunistic infections that can, fungal, bacterial, viral, which is why it's important that we have everyone on supportive medications to try and prevent that from happening. But long-term, that is certainly something that we're seeing. With the talquetamab, there can also be some skin and taste changes, and those are not necessarily right at the inpatient dosing, but we can see that. But those are things we're also managing, in the months after the initial therapy.
Okay. Why is it so important that care partners let the healthcare team know of any changes that they see in their loved ones?
I say this to my patients and their families all the time. They know their family member best, and they may be one to notice that they've been more tired or their energy just isn't the same, or they do have like a little cough that maybe the patient hasn't even and really noticed. And those are all things that we want, we want your observation. We want you to speak up about, because the sooner we address some of these problems, the less complications the patients may have.
What are the supportive medications for somebody who might be having side effects?
Yeah, so with the talquetamab, which is we're primarily seeing a lot of skin side effects and mouth discomfort. A lot of the time we have special mouthwashes to prevent discomfort and irritation, things like Biotine to just keep the mouth moisturized, steroid creams and nail ointments to help with sometimes some peeling of the skin. And then for all bispecifics, we have everyone on viral prophylaxis, something like acyclovir or valcyclovir. PJP prophylaxis, so something like Bactrim or Dapsone. And almost all of our patients are on an IVIG infusion once a month to help support their immune system and prevent against infections.
Alexandra, you mentioned care partner looking for a cough, for instance, in a patient. What other things should care partners be looking for?
Any kind of change in the patient's baseline is always helpful to know. So if people are feeling much more tired, even if you're not due for your therapy, sometimes calling to say that they just don't seem themselves, we can check, their blood counts. And again, sometimes they might need a blood transfusion, or they might need, their white count might be quite low and they might need some Neupogen or filgrastim to help kind of support their blood counts. So really kind of notifying us, even if it doesn't seem like a big thing, it's always better to call.